Well, my name is Meeri Wasberg. I'm a member of Parliament and a deputy member of the Committee on Health and Welfare. I think we have had very interesting and very fruitful discussions all over the day. And I think that one of the challenges, at least from a politician's point of view, is how we do get more for the money that we spend. How do we get more time in healthcare, for example, so that the professionals are able to do what they actually want to do?
Thank you very much. We continue with Bettina. Please tell us from where you are and a reflection that you have when you hear this. Well, this was a political point of view, and your area is kind of political too.
Not political point of view.
Not political. I take it all back.
From I'm Bettina Kashefi, and I work for SALAR, which is SKL, which is the Swedish Association for Local Authorities and Regions. It's an awful long name. Let me just mention that the municipalities and the regions are responsible for healthcare, elderly care, schools, and so forth, and stands for 20% of GDP expenses in this country. So I mean, it's a huge organization and responsibility. And also it's an employers organization that hires 1.1 million. So 1/4 of people employed in Sweden are employed by municipalities or regions. It was a lovely conference, and I really like the perspective of having lots of different disciplines in the discussions. That's very fruitful and very unusual. And let me comment the 3 different seminars and the rapporteurs. I think that all their conclusions are extremely important. I mean, health issues, working with health already from the beginnings, with children and with the elderly, it's essential. Screening and issues like that, I think, is a little bit more complicated, because you must know why you do it, and you must have resources to take care of it. I don't want to know if I'm ill if no one is going to help me treating my disease. So that is sort of an ethical, difficult sort of point of view. And the third workshop, I think, is very, very important with mental disorders. As you said initially here, it's exploding, the proportion of people, in particular youngsters, with mental disorders. And it's a matter of fact, it's the same thing all over the OECD countries. So that is something we have to take care of. Yeah. Thank you very much.
Božidar. Please tell us how to pronounce it. Božidar. Božidar Voljč. Oh, beautiful. Yes, from Slovenia.
Good evening. I enjoyed very much today's meeting. And,
could you please point it towards your mouth, just like an ice cream?
Yes. And in regard to the 3 reports now, I'd like to make some comments. I was part of the group which was discussing concordance, and we didn't reach it. Yeah. But from that way, I would like, as a foreigner, tell to the Swedish audience that it's rather easy to talk about healthy choices in Sweden, because Swedish society is an example of well-functioning society, which is not the case with all other members of the European Union. And healthy choices, to make healthy choices here is much easier than, for instance, in Greece. In spite of that Mediterranean diet was always cited as an example of healthy food next to Scandinavian, of course. But it doesn't help very much for the time being in Greece, which means that healthy choices need also healthy societies and well-functioning societies, which means well-organized, well-financed, and with a lot of social capital. And then it's everything much easier. But nevertheless, I think that since we made during these last decades a huge progress, never seen in history before. That it is questioned what we should do now, at the moment now, that things would be better, maybe it's not necessary at all. Everything will proceed, and I still think that the life expectancy can still proceed, and that we still don't know how long one man can live. To the second report, I would say mostly I would have a comment to gene technology. It is fantastic new kind of preventive, either from individual or from societal point of view. But nevertheless, what I missed are some ethical questions which can come up in time. What I mean, for instance, insurance companies would like to have what's your genetical background? And maybe employers will say, bring us your genetic test. And even families with clean genetic background will avoid to marry their daughters with some very nice looking and successful man with spoiled genetical background. and so on and so on. It would be too much to talk everything about it. In regard to the third group, mental health. Yes, mental health. I don't know quite exactly. Are we talking only about mental health of aging population? No. Or mental health of the whole population?
Oh, good question.
Because this depends on each other.
Yes, but as you were a former health minister in Slovenia, and if you look at the aging population, as this is what, of course, if you are bad off in your 20s, maybe the likelihood that you will have problems when you're older is bigger. But if we look at the aging population that you've been specializing on a lot in Slovenia, what was your reflections when you heard the discussion then for the elderly?
Well, I think that I've been active in Alzheimer cafes in Slovenia. Yes, and I also collaborate very much with people in nursing homes. And you know that people in nursing homes are in very high percentage dement.
Yes.
They have dementia. And before I started to work with them, even when I was a minister, I had not the slightest idea about what I will talk to you now. I'm looking at the dementia question now quite differently as I did before. I met a lady who was a professor of English language. She is strongly dement, but she is still able to talk English. Which means that maybe I have to talk English with her and to make her life nicer and more interesting. And they are still interested in some things. One day I took them to the zoo, and I don't know whether they understood everything, but their faces were happy.
And that's a sign of mental health.
Yes. So that from this point of view, I would say maybe even in case that I will get Alzheimer in some years, maybe it will be not so worse.
You can go to the zoo. Thank you very much. Malin Hollmark.
Yeah, Malin Hollmark. I work at the Swedish Medtech, the trade association for medical technology in Sweden. I'm also a researcher at Uppsala University. And I was very much inspired today and awed from all the competence in this room, and I'm very honored to be here. I have lots of reflections to bring home to my research, and I can't share it all today here. But I have one thing that I really want to mention, And I feel, and please feel free to disagree with me, but I feel that all these three workshop groups come together in something that is self-management, self-control, patient empowerment. And if you would look at the diagnostics on the genetic level, and that would provide me, for instance, with knowledge of an increased risk for, say, let's say cardiovascular disease. What will I do with that knowledge unless I can control it myself? I'm not going to be able to run to a physician all the time and ask, am I okay? I need a green light somehow to know that I'm okay. And there are tools for this today. They're used every day. There's probably, with the amount of data being gathered, like Mitch pointed out, from the adoption, not the inventions today, but from the adoptions of inventions. There's so much data gathered that we can have markers and signals from just to have prognostics instead of diagnostics, to put the control in my hands for my disease. I heard someone talk about what's important for healthy aging, and it is to feel needed, accident prevention, physical activity, nutrition. And all these things I can control myself with different tools that can be provided. So what I feel is needed is somehow the diversity of tools. Like we said, we talked about the diversity of the elderly. Then we need a diversity of tools for the elderly. Let's say we have 97,000 apps today for health. Probably there are some in there that suits me, and some of them will suit you. But I also need someone receiving the data that I feel is important. So self-management is sort of what it boils down for me right now.
Thank you. I can't help associating to the fact that we are different, as you say, and that I remember a study with women with breast cancer who denied their very severe condition, and they were not identified for a second with having cancer, and they survived much better than the ones. So it's easy to say, well, if you have your diagnostics and you can act. It's different on an individual level. Yes. Some really want to have the control and to be prepared and to prevent and act, and some want to live in denial. And that's also important, I would say, to respect that, yes, that diversity. Thank you. Göran, Bexell.
Okay. So we have listened to so many wonderful presentations today, creative and well prepared. I will be very short, 5 comments. The first is a very optimistic view, that I believe that there is concordance on this view, and that is that people can change their lifestyles. That is not self-evident, but they can, and we have to develop it further. And we can develop it in other areas than smoking and so on. This is a very optimistic view, and then a very good argument against determination on self-responsibility. There are possibilities. And the second is a very important question, of course, but raised by one of the delegates here. Who pays? That's a fundamental political and ethical question. Who pays for everything in society? What about self-responsibility? Shall I pay? Shall society pay? Shall the rich pay? Shall there be a combination of my income and how much I pay for my own health care, and so on and so on? And the third is, there was a question here, who, on mental health, it is so important with well-being and meaning in life, in society and in culture, and who creates meaning in life in society? Yes, that's a very good question, and we have to work with this, of course, when we shall develop mental health, which is a fundamental, also for healthcare. And the fourth is, how can we combine equality in healthcare with self-responsibility. We must be able to combine self-responsibility, concrete consequences of my lifestyles, with equality in healthcare. And that is a great challenge for healthcare and for politicians. And our economists have to develop different economic models for this, I hope. And the fifth is a point of view from the university. And I believe that we can construct more research and education projects which are cross-disciplinary, because that's necessary and important. Medicine, of course, but also social sciences and economy and humanities and theology and so on must combine with the different perspectives to develop models for these questions we have worked with healthcare. Okay.
Thank you. I know we're overdue, but one final word from your respective perspective when it comes to if you had all the power and you were to prepare for the healthy aging, which is the topic for this conference, where would you start? What would be your main main arena? I mean, you have some power, but maybe not all yet. But where would you start?
Well, it's good to have the possibility to pretend that you have all the power.
You're
for
social
one day.
democratic, yeah?
Yeah,
right?
I'm social democrat.
Pretend,
so
yeah?
We can pretend
knows?
today.
Yeah.
In autumn we will know.
Yes.
I think that there are several things that you have to do. Of course, you have to deal with those who are in the aging population today. But I do think that we have more impact if we start early on. With children. We have talked about how difficult it is to change our habits, especially the bad ones. So why do we get bad habits? Why can't we get good habits from the beginning, starting in school? So I think that is very important. It will probably not solve all the problems, but some of them. And when it comes to those who are who already are of high age or even high age today, I think it's the most important thing is to use the technology in such a way that we free more people power. So we get a chance to get this meaningful coordination with other people, even when you are very old and very ill.
Thank you. Bettina, where would you start?
Well,
you also have a lot of power.
Do I?
Yeah.
I certainly agree that we have to use technology better, but in my dream, we would sort of work with lifestyle issues, and also remember they are very unevenly distributed. We know that poor health is very well correlated with low incomes, so that is really a political challenge and a challenge for the healthcare system as well. But what I do know as an economist, that we have enough resources to sort of cover expenditure for the welfare sector in the long run if we only look upon the demographic sort of development. But if we have a future development in accordance with the historical development, where we have an increase of a yearly increase of 1% of consumption of the welfare sector, sort of, then we have a resource gap of 200 billion Swedish crowns. Or put it in a different perspective, we have to raise taxation with 13 Swedish crowns, approximately 40% taxation at a local level, and we do not want to do that. So we have to work with other issues. More work, more hours worked in the economy, get the students earlier out from school, let them be efficient in school, out and work many hours while in the workforce, and stay on work longer than you do today. So no compulsory pension age. I think that is very necessary. And then, of course, work with productivity and IT in the welfare sector. I stop there. Thank you.
Thank you. Božidar?
I would be again in power.
Yes?
I would increase the power of patients. And
Sorry, yeah, you
patient
would be gaining
Yes.
power, you would increase the
Okay.
power of patients.
patients and illnesses compared with power of doctors. Because patients, especially those elderly with chronic conditions, they are together with their diseases 24 hours per day. And only from time to time they meet their doctors for maybe for 10 minutes or something like that. And that is that, and chronic conditions are incurable. You can't cure them, that's why they are chronic. And now it's a question, do we consider them as a permanent enemy or my life partner? And if we consider them as life partners, then we make, let's say, a contract with them. You can be here with me, that patient says. And the illness said, I'll be quiet, very quiet, if you don't excite me. Which means that the healthy choice and healthy lifestyle can be very much combined with a chronic illness. And this is maybe a kind of health literacy in future. And those who are already living in a healthy way, they don't need very much support. But those who are ill and who fight, let's say, or live together with a chronic condition, they should be supported, not so much from financial point of view or from healing point of view, but from the point that you should make a contract with your illness. And I would like to cite that Stanford University started from 10 years or more with self-management patient groups with chronic conditions, which means that within these groups there is a huge public health potential which is neglected. And if we put them together, they can exchange their views. And we made a research, and I will stop here only to tell you that our thesis was that within the social gradient, those who are more educated and more socially secure live longer and so on and so on. And those on the other part of social scale, less and so on. And we put them together with the intention, this capital here on the rich part of scale can improve if they discuss, let's say in regular meetings, their illness, they can push them a little bit up. The result was that even those who are more educated can learn from those on the other side of scale.
Yeah.
They are not so much educated. They have not so much money as this one, but they are not stupid. They are intelligent as well. And they also gather very, very important experience with their illnesses. And I think that maybe here can we search for new ways in dealing with chronic diseases in the elderly population.
Wonderful. Thank you so much.
Well, I would think perhaps we'd be empowered together then with the self-management. So if we were, I would take the aspect of the distributed care where we need to spread the resources. And to be able to do this, I would turn to technology like you mentioned, and important aspects of standardizations for e-health, and also to build a robust IT infrastructure. The way we have water or energy supply, we would have to have a robust data traffic. That would be not very colorful vision, perhaps, but I would get down to that.
And you have confidence in the industry wanting to play that role?
Well, you would need, at least in Sweden, the way it's built, to have policy.
Policies are needed.
Definitely.
Thank you. Göran, finally.
Okay, my contribution could be that a vital debate in society and in healthcare is very important for the development of healthcare. And that debate should include, of course, the question of ethical values. And one of the tasks is to promote a society with common values and the possibility of individual choices in healthcare.
Wow. I would like us first to applaud this wonderful panel. Thank you. Thank you.